Knee replacement is a very effective surgery for treating knee arthritis, but unfortunately there are some ways where the recovery can go wrong. Sure, there are some well-known pitfalls like not taking the medications as prescribed, jumping back into too much activity too soon, or neglecting your physical therapy exercises, but one of the most common mistakes that I've seen patients make after knee replacement actually isn't any of these things. The mistake that I'm referring to, which is one that can cause problems for even the healthiest and most prepared of patients, is comparing your progress too closely to others. I've watched this single habit turn what should be encouraging milestones into sources of anxiety, frustration, and even pain. If you recently had your knee replaced, or you're planning on having it replaced in the future, this video could save you weeks or even months of unnecessary worry and unnecessary pain. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a board-certified orthopedic surgeon. After residency, I completed fellowship training at Harvard Medical School specifically for hip and knee replacements. Knee replacement is the single most common surgery that I perform, and I've seen firsthand just how damaging the comparison trap can be. Let me give you an example. You're 2 weeks out from a knee replacement, still using a walker, and feeling pretty good about your progress. Then you run into your neighbor at the mailbox, and she mentions that she was walking without a walker at 1 week after surgery when she had her knee replaced 2 years ago. Suddenly, you're questioning everything. Is something wrong with your knee? Are you behind schedule? Should you be worried? Or maybe you're scrolling through a knee replacement support group online, and someone posts about playing golf 2 months after surgery while you're still working on climbing stairs comfortably during that same time frame. This kind of comparison is incredibly common, and don't get me wrong, I can understand why it happens. When you're in the middle of recovery, you're looking for benchmarks to know if you're on track. After all, you really have no frame of reference to use, especially if this is your first knee replacement. Other people's experiences feel like a roadmap for what you should expect. But here's what is critical to understand. Every single recovery is different, and comparing yourself too closely to others can legitimately set you back. So why is comparing yourself to others so problematic? First, it can create unrealistic expectations. When you hear about someone else's rapid recovery, you might not be getting the full story. You may not know the condition of their knee before surgery, the state of their other joints that provide support during their recovery, how their medical background compares to yours, or frankly, even if they're being completely accurate about their timeline. That's not to say that they're being intentionally misleading, but some people legitimately lose sight of their early struggles after surgery, especially if it's been a while. Second, comparison often leads to anxiety, and anxiety truly interferes with progress. When you're constantly worried about falling behind, that stress can actually increase the pain that you feel. Please understand that this is not at all an attempt to say that it's just in your head. Multiple studies have repeatedly confirmed that mental well-being can have a massive impact on the pain that you feel. So this is real science, and I'm talking about real pain. Knee replacement is painful enough as is, and you don't benefit by adding to it unnecessarily. Third, if you feel like you're falling behind, you may feel pressured to push yourself harder with physical therapy and overexert yourself too soon. If you overdo it, you may not necessarily damage your new knee, but you may repeatedly exacerbate the inflammation more than you need to. This can lead to repeated cycles of inflammation and recovery from these flare-ups, which can end up lengthening your overall recovery in the long term. In order to avoid the temptation to overcompare, I do think it's helpful to have an idea of what to expect after surgery. So, what does a normal recovery actually look like? Well, these are averages, so there is absolutely some variability to be expected, but most people can walk short distances within their home and get themselves dressed essentially immediately after surgery. Many people are done with assistive devices by about the 6-week mark. By 3 months, most people have resumed the majority of activities that they would like to return to, albeit with some discomfort still. By 6 months, most of the recovery is usually complete, but patients often notice improvements up to 1 year, and even beyond. And again, since these are averages, individual experiences differ widely. If we were to look at the recovery of every single patient who has ever had a knee replacement in the world and tallied their recoveries on this chart, it would look something like this. Time to full recovery is on the x-axis, and the number of patients that took that long to recover is on the y-axis. Most patients are naturally somewhere in the middle. You may end up recovering exceptionally quickly, which is great if that's the case, but you could just as easily be on the other side of the curve. Even though we surgeons do our best to predict how each individual patient will recover, the reality is that we just don't know for sure until that recovery has already happened. There are many factors that influence your recovery timeline: your age, the health of your internal organs, the state of your knee before surgery, and how well you participate in physical therapy all play major roles. Your support system at home also impacts how quickly you bounce back. Despite taking all these factors into account, there's still a small element of unpredictability, and I'll even take it a step further with another example. In situations where one surgeon performs knee replacement on both knees of a single patient, it's very common for one knee to recover faster than the other. Same patient, same surgeon, same procedure, but different recovery timelines. Sometimes the second knee does better because the patient knows what to expect. Other times the first knee had more arthritis and the improvement was more immediately noticeable, so the second knee feels a little bit slower. The point is, even if we try to control as many variables as possible, recovery still varies. Your body heals at its own pace, and that pace is influenced by some factors that are outside of your control. Now, I want to be clear. There are absolutely some legitimate reasons to be concerned. Signs of infection, like increased redness or drainage from your incision, signs of blood clots, like sudden swelling in your legs or chest pain, or truly uncontrolled pain that is not responding to pain medications. These are serious problems and should be addressed immediately. If you are in this situation, you should call your surgeon's office immediately and consider calling 911 or going to the emergency room for an immediate evaluation. Less urgent but still important concerns are things like the range of motion improvements in your knee stalling for a few weeks, or the strength of your knee deteriorating over time. It's absolutely reasonable to contact your surgeon's office with any concerns that you have. But if you find yourself constantly dwelling on whether you're falling behind your friend or family member, that's the comparison trap. So here's how to avoid it. First, limit your exposure to recovery stories, especially on social media. These platforms often showcase the best recoveries, not necessarily the typical ones. After all, people tend to share the best parts of their lives, not the worst parts for everyone to see. So these experiences may be biased toward the positive side. Second, focus on your own week-to-week progress rather than comparing to some arbitrary timeline. Are you doing more now than you could last week? That's likely what matters. Third, expect ups and downs. Very few people have a completely smooth and setback-free recovery. For example, it's normal to accidentally overdo it with physical therapy one day and spend the next few days recovering, so take the positive approach of learning from it as you move forward. Lastly, trust your medical team. If you are genuinely concerned about your progress, then absolutely contact your surgeon's office, and they can help determine if something is in fact going wrong. Providing reassurance is a massive part of our job, but it's obviously also critical for us to identify those times where the concern is justified. Look, recovery after a knee replacement is frequently challenging, and it isn't a race. The only person you should be consistently comparing yourself to is the person you were last week. Stay focused on you, trust the process, and remember that steady improvement, even if it feels slow at the time, is still improvement. If you're considering a knee replacement and you'd like to know exactly what a knee replacement is, I'll link my video on that topic right here. If you found this to be helpful, click the like button so I know to keep making videos like this one, and leave me a comment down below on what you'd like me to cover in the future. Stay well, and I'll see you in the next video.